This is your compartment pressure monitoring device, as I mentioned. This is what the device looks like. So just as another reintroduction, this is your on-off button here. If you flip this switch down here on the LCD screen, if you don't get double dashes or a number, that's a sign that the battery is probably dead or there's no battery in it. You can turn it over on the back side here, pop in a penny or a dime is probably the best coin. Just pops off the cover. You can change the battery or put a battery in there. It takes a 9-volt battery. On the back here below that actually is where you will find the instructions you can read on how to set up what I'm going to show for you here this morning. But because we realize that that's such a small print, on the front you actually have this QR code. You can scan this QR code with your phone and it takes you straight to the C2DX website, and it shows you videos on how to walk you through setting up the monitor, what I'm going to show for you here today. So as I mentioned, kept in your wall cabinet with your pressure monitor is your disposable needles. This wall cabinet here to my left. Disposable packaging looks like this. It comes with your 3 components, which is your saline syringe, your side-ported needle, and what we call the diaphragm for the pressure monitor. These 3 pieces go together like so. Some diaphragms, as I mentioned, will come with this blue extension cap right here. Some of them don't. If it doesn't have it, then you have this red piece that's internal on the diaphragm. That's the side that the saline syringe goes in. And with the extension tubing or not, just goes onto there with a quick little turn. This part sits down into the diaphragm, into your transducer compartment is what we call it. There we go. Little snap, standing there snug. Your housing cover closes around it. If it doesn't have that blue piece right there, then that just means that these flanges on the outside of the monitor are going to be inside of the housing cover. So you just want to turn that to make sure that they lay flat so that your housing cover shuts. Your 18 or 20 gauge side ported needle goes onto this side, and this is what the monitor looks. It's pretty big. This is what the monitor looks like put together. Now for the staff, you could get to this point and pass it to the physician, or you can do one more step, which is flushing it, what we call establishing a water column. And that's flushing all the air out of your diaphragm, out of your needle, to assure that we have a true water column. This has to be done at a 45-degree angle. So give it a quick little push here. You see it coming up through the needle, 45-degree angle. You get a couple of droplets right there. That lets you know that you're good. Has to be done at a 45-degree angle because there is air inside of the saline syringe, and we want to make sure that all of the air is pushed out of it. So that's why 45-degree angle is the best. You can do it upward, but that ensures that water can truly run down. If liquid or saline gets underneath your diaphragm, then that's going to skew your readings, and you're going to have to wipe it dry and start all over again. So 45-degree angle is best. Once it is flush and ready, that's when you would then pass a physician. And once the patient is numbed and prepped, they can palpate the leg where it's most common, the leg, to assure that they're in the right compartment, and then they're ready to test. So from there, what the physician is going to do is they're going to find the proper angle to test the compartment. So the 4 compartments that I have here, you have your lateral, your anterior, superficial, and then deep posterior. Once they find this, let's say for example, I'm going to test the lateral compartment. I'm going to come in at this downward angle here. Before the doctor then sticks the patient, you have to zero this out. That's what that 0 button is for. It assures that we get an accurate reading, because after I push this 0, you see the numbers when I change the angle change on the monitor. So the different angles will change the pressure. So assure that you get the most accurate pressure reading. You want to hit 0 and then stick the patient. About 0.3 cc's of saline is then administered into the compartment. That's all you need. 0.3 cc's, just make sure that you get any excess blood or tissue out of the way of the side ported needle. And then 3 to 5 seconds, you're gonna get an accurate pressure reading. Why we do oranges? Because oranges have compartments. So this is showing a compartment of 0.2, you know, a more, I would say a less ripe orange would probably be a little bit harder, would go up there. Normal compartment pressure ranges from 0 to 10 millimeters of mercury is how it's measured. 10 to 20 is going to be slightly elevated. So if you have patients that come in and they register between that 10 to 20, that's going to be something that you're going to want to monitor over time, which can be then antibiotics or therapy to see if it goes up or down. 30 is our threshold. So if they come in testing 30 or above, that's going to be sign for emergency. They're going to likely be admitted for, to relieve the pressure, fasciotomy, that right there. But this is a device that you can use to assure that you have an accurate diagnosis before those procedures are needed. And that's the device. Very simple to put together for the staff and then for the physicians. It's been a standard device that's been used to assist with diagnosing compartment training for a long time, but very simple.